Question 1. The evaluation methodology shows that a neonate born at 32 weeks gestation, currently 48 hours old, exhibits a new onset of mild tachypnea, respiratory rate 70 breaths per minute, and slight subcostal retractions during feeding. The nurse has assessed the infant's oxygen saturation to be 94% on room air, which is within acceptable parameters for this gestational age. Based on the established institutional follow-up protocols for abnormal respiratory findings in neonates, which of the following actions is the most appropriate immediate next step? Option A. Notify the neonate's primary healthcare provider immediately to report the new respiratory findings and discuss the plan for further assessment and management. Option B. Continue routine care and monitoring, as the infant's oxygen saturation remains within acceptable limits and the respiratory rate is only mildly elevated. Option C. Discuss the observed tachypnea and retractions with the charge nurse to get their opinion on the best course of action before contacting the physician. Option D. Document the respiratory findings in the infant's chart and reassess the infant's respiratory status in 2 hours to see if the symptoms have resolved spontaneously. Correct answer is A. Notify the neonate's primary healthcare provider immediately to report the new respiratory findings and discuss the plan for further assessment and management. Explanation. This scenario presents a common yet critical challenge in neonatal nursing, managing abnormal findings that require timely and appropriate follow-up. The professional challenge lies in accurately interpreting the significance of the finding, understanding the established protocols, and acting decisively to ensure the infant's well-being while adhering to regulatory requirements for documentation and communication. Failure to follow established protocols can lead to delayed diagnosis, suboptimal treatment, and potential adverse outcomes for the neonate, as well as professional and institutional liability. The correct approach represents best professional practice because it aligns with established guidelines for managing abnormal findings in neonates, which are typically dictated by institutional policies, professional standards of care, and potentially specific regulatory mandates, e.g., those related to reporting certain conditions or ensuring continuity of care. This approach prioritizes immediate, evidence-based action, thorough documentation, and clear communication with the neonate's primary healthcare provider. This ensures that the abnormal finding is addressed promptly and that all relevant parties are informed, facilitating a coordinated and effective management plan. Adherence to these protocols is ethically mandated to provide competent and safe care, and is often a requirement under healthcare regulations that govern quality of care and patient safety. An incorrect approach that involves delaying notification of the primary healthcare provider until the next scheduled assessment is professionally unacceptable. This failure constitutes a breach of the standard of care, as it introduces an unnecessary delay in addressing a potentially serious issue. Ethically, it violates the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory frameworks often mandate timely reporting of significant clinical findings to ensure prompt intervention and prevent adverse events. Another incorrect approach, such as documenting the finding but taking no immediate action or further investigation, also represents a significant regulatory and ethical failure. This passive approach neglects the nurse's responsibility to advocate for the neonate and ensure appropriate management. It can be seen as a failure to meet the standard of care and may violate regulations pertaining to patient assessment and intervention. Finally, an incorrect approach that involves discussing the finding with a colleague without involving the primary healthcare provider or initiating the established follow-up protocol is also professionally problematic. While collegial discussion can be valuable, it does not substitute for the formal process of reporting to the responsible physician or initiating the prescribed follow-up. This can lead to miscommunication, delays, and a failure to adhere to established care pathways, potentially contravening regulatory requirements for clear lines of communication and accountability in patient care. Professionals should employ a decision-making process that begins with recognizing and accurately assessing the abnormal finding. This is followed by immediate consultation of institutional policies and evidence-based guidelines for that specific finding. The next step involves prompt communication with the primary healthcare provider, initiating any prescribed diagnostic or therapeutic interventions, and meticulously documenting all actions and communications. This systematic approach ensures that care is both timely and compliant with professional and regulatory expectations. Question 2. Process analysis reveals a neonatal nurse is caring for a 3-day-old infant born at 38 weeks gestation. The infant exhibits intermittent periods of jitteriness, particularly when startled, and has a slightly increased respiratory rate of 55 breaths per minute, though oxygen saturation remains stable at 96%. The nurse also notes that the infant is latching well during feeds, but seems to have a weaker cry than expected. The nurse is considering how to interpret these findings in the context of normal neonatal development and potential deviations. Which of the following approaches best reflects the identification of normal versus abnormal findings in this neonatal assessment? Option A. Compare the infant's respiratory rate and jitteriness to established norms for a term infant, noting that while the respiratory rate is at the upper limit of normal, the jitteriness warrants further investigation due to its persistence and association with stimuli, and the weaker cry is also a deviation from expected vigor. Option B. Consider the infant's findings in comparison to a premature infant of 32 weeks gestation, as some signs might be attributed to delayed maturation. Option C. Rely primarily on the parent's report that the infant is just a bit fussy and attribute the increased respiratory rate to recent feeding activity. Option D. Dismiss the jitteriness as a normal developmental phase for all newborns and focus solely on the respiratory rate, assuming it will self-resolve. The correct answer is A. Compare the infant's respiratory rate and jitteriness to established norms for a term infant, noting that while the respiratory rate is at the upper limit of normal, the jitteriness warrants further investigation due to its persistence and association with stimuli, and the weaker cry is also a deviation from expected vigor. Explanation. This scenario is professionally challenging because the neonatal nurse must differentiate subtle variations in infant behavior and physiological signs, some of which may indicate a deviation from normal development or a developing complication. Accurate identification is critical for timely intervention, preventing potential harm, and ensuring optimal outcomes for vulnerable neonates. The nurse's judgment directly impacts the infant's health trajectory. The correct approach represents best professional practice because it involves a systematic, evidence-based assessment that prioritizes objective data and established neonatal norms. This aligns with the fundamental principles of neonatal nursing care, emphasizing vigilant observation, accurate documentation, and prompt communication with the healthcare team. Adherence to established clinical guidelines and protocols, which are often rooted in regulatory frameworks and professional standards of practice, ensures that care is safe, effective, and meets the expected standard of competence. This approach minimizes the risk of misdiagnosis or delayed treatment. An incorrect approach that relies solely on parental report without independent objective assessment fails to meet the professional standard of care. Regulatory frameworks and professional nursing standards mandate that nurses conduct their own comprehensive assessments. Over-reliance on subjective information can lead to overlooking critical objective signs of distress or illness, potentially violating ethical obligations to provide competent care and regulatory requirements for accurate patient assessment. Another incorrect approach that involves dismissing subtle findings as insignificant without further investigation is professionally unacceptable. Neonatal physiology is delicate, and early signs of abnormality can be easily missed. Regulatory guidelines and ethical principles require nurses to investigate any deviation from the norm, especially in a vulnerable population. Failure to do so could be considered negligence and a breach of the duty of care. Further incorrect approach that involves comparing the infant's findings to a different gestational age or developmental stage than the infant's actual age is also problematic. This misapplication of developmental norms can lead to misinterpretation of findings, either by over- or underestimating the significance of observed signs. Professional practice demands that assessments are benchmarked against the infant's correct chronological and corrected gestational age, as stipulated by evidence-based guidelines and regulatory expectations for accurate patient evaluation. The professional decision-making process for similar situations involves a structured approach. 1. Gather objective data through direct observation and assessment, e.g., vital signs, physical examination, behavior. 2. Correlate findings with established neonatal norms for the infant's specific gestational and chronological age. 3. Consider subjective data from parents or caregivers, but always validate it with objective findings. 4. Document all findings meticulously. 5. Consult with experienced colleagues or supervisors if there is any uncertainty. 6. Communicate any concerning findings promptly to the appropriate healthcare provider. This systematic process ensures that care is grounded in evidence and patient safety. Question 3. Implementation of a comprehensive physical assessment for a neonate presenting with subtle changes in feeding behavior and intermittent modeling. What approach best ensures accurate risk identification and patient safety? Option A. A superficial visual inspection of the infant while the infant is actively feeding. Option B. A rapid, focused assessment targeting only the gastrointestinal and integumentary systems, given the presenting symptoms. Option C. A systematic head-to-toe assessment, beginning with observation of the infant's general appearance and behavior before proceeding to detailed examination of each body system. Option D. Prioritizing immediate initiation of diagnostic imaging and laboratory tests based on the reported symptoms. The correct answer is C. A systematic head-to-toe assessment, beginning with observation of the infant's general appearance and behavior before proceeding to detailed examination of each body system. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent vulnerability of the neonatal patient and the critical need for accurate and timely assessment to identify subtle signs of distress or abnormality. The nurse must balance the need for a thorough physical examination with the infant's physiological stability and the potential for iatrogenic stress. The complexity arises from the diverse range of potential findings, from common physiological adaptations to life-threatening conditions, requiring a systematic and informed approach. Correct approach analysis. The correct approach involves a head-to-toe, systematic physical assessment, prioritizing observation of the infant's overall state before direct manipulation. This aligns with best professional practice by ensuring a comprehensive evaluation of all body systems, allowing for the detection of subtle deviations from normal. This systematic method minimizes the risk of overlooking critical findings and provides a baseline for future assessments. Ethically, it upholds the principle of beneficence by acting in the infant's best interest and non-maleficence by minimizing potential harm through a structured and gentle approach. Regulatory frameworks for neonatal nursing emphasize the importance of skilled assessment and documentation as fundamental to patient safety and quality care. Incorrect approaches analysis, focusing solely on the most obvious signs of distress without a systematic head-to-toe assessment, risks missing less apparent but equally significant issues. This approach is ethically flawed as it deviates from comprehensive care and may violate the principle of beneficence by failing to identify all potential problems. It also fails to meet regulatory expectations for thorough patient evaluation. Performing a rapid, superficial assessment without adequate time for observation or detailed examination is another incorrect approach. This is professionally unacceptable as it compromises the accuracy and completeness of the assessment, potentially leading to delayed diagnosis and treatment. It is a failure of professional duty and a breach of ethical obligations to provide diligent care. Prioritizing invasive procedures over a comprehensive physical assessment, unless medically indicated, is also inappropriate. This approach can cause unnecessary stress and discomfort to the neonate, potentially impacting their physiological stability. It demonstrates a lack of clinical judgment and a failure to adhere to the principle of least harm, which is a cornerstone of neonatal care and is often reflected in nursing practice standards and guidelines. Professional reasoning. Professionals should employ a structured decision-making process that begins with understanding the patient's history and current clinical status. This is followed by a systematic, head-to-toe physical assessment, prioritizing observation and gentle palpation. The nurse should continuously integrate findings with their knowledge of neonatal physiology and common pathologies. If any deviation from normal is noted, further focused assessment and appropriate interventions are initiated. Documentation of all findings and actions is crucial for continuity of care and legal protection. This process ensures that care is evidence-based, patient-centered, and meets professional and regulatory standards. Question 4. Cost-benefit analysis shows that early, targeted diagnostic investigation for neonatal anemia, even in preterm infants, is more effective than a wait-and-see approach or immediate aggressive intervention. A 30-week gestation neonate presents with pallor and a hemoglobin of 12G/DL, Which of the following nursing actions best reflects best practice in this scenario? Option A. Administer a packed red blood cell transfusion to rapidly increase the hemoglobin level and improve oxygen carrying capacity. Option B. Initiate a full hematological workup including reticulocyte count, peripheral blood smear, and iron studies, and consult with the neonatologist regarding potential causes and management. Option C. Reassure the parents that this hemoglobin level is normal for a preterm infant and monitor for further changes without immediate intervention. Option D. Focus solely on optimizing feeding practices to encourage endogenous red blood cell production, deferring further investigations. Correct answer is B. Initiate a full hematological workup including reticulocyte count, peripheral blood smear, and iron studies, and consult with the neonatologist regarding potential causes and management. Explanation. Scenario analysis. This scenario presents a common challenge in neonatal nursing, where a neonate exhibits signs suggestive of a hematological disorder, specifically anemia, requiring prompt and accurate assessment and intervention. The professional challenge lies in differentiating between physiological anemia of prematurity and more serious pathological causes, necessitating a nuanced understanding of diagnostic indicators and treatment thresholds within established clinical guidelines. The urgency of the neonate's condition demands a swift yet evidence-based decision-making process. Correct approach analysis. The correct approach prioritizes a comprehensive assessment that includes a detailed history, physical examination, and appropriate laboratory investigations as guided by current neonatal nursing practice standards and relevant guidelines. This aligns with the principle of beneficence, ensuring the neonate receives timely and appropriate care. Adherence to established protocols for managing neonatal anemia, such as those outlined by professional bodies governing neonatal care, ensures that interventions are evidence-based and minimize potential harm. This approach reflects a commitment to patient safety and quality of care, which are paramount in neonatal nursing. Incorrect approaches analysis. One incorrect approach involves delaying further investigation based solely on the neonate's gestational age, assuming physiological anemia without ruling out other causes. This fails to uphold the duty of care and could lead to delayed diagnosis and treatment of a more serious underlying condition, violating the principle of non-maleficence. It also disregards the need for individualized assessment. Another incorrect approach is to immediately initiate aggressive treatment, such as blood transfusion, without a thorough diagnostic workup and consideration of less invasive interventions. This could lead to unnecessary risks associated with transfusion, such as fluid overload or transfusion reactions, and may not address the root cause of the anemia. This approach is not cost-effective and potentially harmful, contravening principles of judicious resource utilization and patient safety. A third incorrect approach is to rely solely on parental requests for specific interventions, without independent clinical judgment and adherence to established guidelines. While parental involvement is crucial, the nurse's professional responsibility is to provide care based on clinical evidence and best practice, not solely on parental preference, especially when it may not be in the neonate's best interest. This could lead to inappropriate or delayed care. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the neonate's clinical presentation. This involves gathering subjective and objective data, including maternal history, birth circumstances, and the neonate's current status. Next, they should consult relevant evidence-based guidelines and protocols for neonatal anemia management. This guides the selection of appropriate diagnostic tests and therapeutic interventions. Finally, continuous evaluation of the neonate's response to treatment and ongoing communication with the healthcare team are essential for optimizing care and ensuring the best possible outcome. Question 5. Investigation of a 30-week gestation neonate born via spontaneous vaginal delivery, currently receiving parenteral nutrition, reveals the following: stable vital signs, adequate respiratory effort, and a weight of 1.2 kg. The infant exhibits occasional rooting reflexes but demonstrates disorganized sucking and swallowing patterns when a pacifier is offered. The mother expresses a strong desire to begin oral feeding. Which of the following approaches best reflects the assessment of feeding readiness and nutritional needs in this neonate? Option A. Initiate a structured oral feeding regimen with a specialized nipple and monitor closely for signs of intolerance, gradually increasing volume as tolerated. Option B. Begin with small, frequent oral feeds using a standard nipple, focusing on meeting the mother's desire to initiate feeding. Option C. Introduce gavage feeding to supplement parenteral nutrition and assess for oral feeding readiness during gavage feeds. Option D. Continue parenteral nutrition and postpone oral feeding attempts until the infant demonstrates consistent, coordinated sucking and swallowing reflexes. The correct answer is A. Initiate a structured oral feeding regimen with a specialized nipple and monitor closely for signs of intolerance, gradually increasing volume as tolerated. Explanation: this scenario is professionally challenging because assessing feeding readiness and nutritional needs in neonates requires a nuanced understanding of physiological maturity, developmental cues, and individual variations. The nurse must integrate multiple data points to make informed decisions that directly impact the infant's growth, development, and well-being, while also adhering to established clinical guidelines and best practices. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that considers both objective physiological parameters and observable behavioral cues. This aligns with the principles of evidence-based neonatal care, emphasizing a holistic view of the infant. Adherence to established protocols for feeding readiness assessment, such as those outlined by professional neonatal nursing organizations, ensures a standardized yet adaptable approach. This promotes patient safety by minimizing the risk of feeding intolerance, aspiration, and inadequate nutrient intake, thereby supporting optimal neonatal outcomes. An incorrect approach that relies solely on chronological age for initiating oral feeds fails to acknowledge the significant variability in neonatal development. This can lead to premature oral feeding attempts in infants who are not physiologically ready, increasing the risk of aspiration, feeding difficulties, and delayed weight gain, which contravenes the ethical obligation to provide safe and effective care. Another incorrect approach that focuses exclusively on the mother's desire for oral feeding, without a thorough assessment of the infant's readiness, disregards the infant's best interests and the nurse's professional responsibility to advocate for the neonate. This can result in the infant being subjected to feeding challenges they are not equipped to handle, potentially leading to distress and negative feeding experiences, and failing to uphold the ethical principle of beneficence. A further incorrect approach that delays oral feeding initiation based on a single, transient sign of immaturity, without a comprehensive reevaluation of the infant's overall readiness, can lead to unnecessary delays in establishing adequate nutrition. This may negatively impact the infant's growth trajectory and prolong the need for alternative feeding methods, which is not in the infant's best interest and may not align with current best practice guidelines for timely nutritional support. The professional decision-making process for similar situations should involve a systematic evaluation of the infant's gestational age, birth weight, neurological status, respiratory stability, gastrointestinal function, and observable feeding cues. This should be followed by a review of current evidence-based guidelines for neonatal feeding. The nurse should then collaborate with the healthcare team, including physicians and dietitians, to develop an individualized feeding plan. Ongoing reassessment and adaptation of the plan based on the infant's response are crucial. Question 6. Compliance review shows that a neonatal nurse is tasked with assessing the gestational age of a newborn admitted to the Neonatal Intensive Care Unit, NICU. The nurse has been trained in the use of both the Ballard and Dubovitz scales. Which of the following approaches best aligns with regulatory expectations and best professional practice for this critical assessment? Option A. Forming a quick assessment of only one or two easily observable physical signs, such as skin turgor, to estimate gestational age. Option B. Using a generic online calculator that requires minimal input of infant characteristics without referencing a validated scale. Option C. Relying primarily on the mother's reported date of her last menstrual period (LMP) as the sole determinant of gestational age. Option D. Administering a comprehensive Ballard or Dubovitz scale assessment, integrating both physical and neuromuscular characteristics and documenting the findings. The correct answer is D. Administering a comprehensive Ballard or Dubovitz scale assessment, integrating both physical and neuromuscular characteristics and documenting the findings. Explanation: this scenario presents a common challenge in neonatal care where accurate gestational age assessment is crucial for appropriate clinical management and resource allocation. The professional challenge lies in ensuring the chosen method for gestational age assessment is both accurate and compliant with established nursing standards and institutional protocols, which are often informed by regulatory guidelines. The stakes are high, as miscalculation can lead to delayed or inappropriate interventions, impacting infant outcomes and potentially leading to regulatory scrutiny. The correct approach represents best professional practice because it prioritizes a comprehensive and validated method for gestational age assessment, aligning with the established standards of care for neonatal nursing. Utilizing a recognized scale like the Ballard or Dubovitz, when applied correctly by a trained neonatal nurse, provides a standardized and objective measure. This adherence to evidence-based practice and established protocols is a cornerstone of regulatory compliance and ethical nursing care, ensuring that the infant receives care tailored to their developmental stage. An incorrect approach, such as relying solely on maternal recall of the last menstrual period, LMP, without corroboration, presents significant regulatory and ethical failures. Maternal recall can be notoriously inaccurate due to various factors, leading to a misestimation of gestational age. This misestimation can result in the infant being managed as either preterm or post-term when they are not, leading to inappropriate interventions or a lack of necessary ones. Ethically, this constitutes a failure to provide individualized and evidence-based care. From a regulatory standpoint, it deviates from the expected standard of care, potentially violating guidelines that mandate accurate assessment for optimal infant management. Another incorrect approach, such as using a single physical sign without considering the full spectrum of the assessment scale, is also professionally unacceptable. Gestational age assessment scales are designed to integrate multiple physical and neuromuscular characteristics for a more reliable estimation. Relying on a single sign is reductionist and increases the likelihood of error, failing to meet the standard of a thorough and systematic assessment. This can lead to misclassification of gestational age, with the same negative consequences as relying solely on LMP. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the clinical need for gestational age assessment. 2. Consult institutional policies and nursing practice guidelines to determine the preferred and validated methods. 3. Select the most appropriate assessment tool, e.g., Ballard or Dubovitz, based on the infant's condition and the nurse's training and proficiency. 4. Perform the chosen assessment meticulously, adhering to the standardized criteria for each component. 5. Corroborate findings with other available data, such as early ultrasound dating if available, to enhance accuracy. 6. Document the assessment findings and the estimated gestational age clearly and comprehensively. 7. Communicate the findings to the healthcare team to inform clinical decision-making and care planning. Question 7. System analysis indicates a neonate in the neonatal intensive care unit who has been receiving continuous nasogastric tube feedings, is now exhibiting abdominal distension, increased gastric residual volume, and decreased bowel sounds. The nurse is the first to observe these changes. Which of the following actions should the nurse prioritize? Option A. Consult with a senior neonatal nurse to discuss potential differential diagnosis. Option B. Review the infant's complete past medical history and previous feeding records. Option C. Immediately perform a thorough physical assessment of the infant, including abdominal palpation, and assess vital signs. Option D. Contact the neonatologist to report the observed changes and request guidance. The correct answer is C. Immediately perform a thorough physical assessment of the infant, including abdominal palpation, and assess vital signs. Explanation. This scenario is professionally challenging due to the critical nature of neonatal gastrointestinal disorders, such as necrotizing enterocolitis, NEC, which can rapidly progress and have devastating consequences. The complexity arises from the need for timely and accurate assessment, prompt intervention, and effective communication among a multidisciplinary team, all while adhering to established neonatal nursing standards and best practices. The infant's fragile state and the potential for rapid deterioration necessitate a high degree of vigilance and a systematic approach to care. The correct approach represents best professional practice because it prioritizes immediate, direct assessment of the infant's current clinical status and vital signs. This aligns with the fundamental nursing principle of assessing the patient first. In the context of a suspected gastrointestinal emergency like NEC, rapid physiological changes are common. A thorough physical examination, including abdominal assessment, distension, tenderness, bowel sounds, color, and vital sign monitoring, heart rate, respiratory rate, temperature, blood pressure, oxygen saturation, are crucial for identifying signs of compromise and guiding immediate interventions. This proactive and patient-centered approach is supported by professional nursing standards that emphasize the nurse's role in early detection and response to deteriorating conditions. Ethical considerations of beneficence and non-maleficence demand that the nurse act swiftly to protect the infant from harm. An incorrect approach that involves immediately contacting the neonatologist without first performing a direct patient assessment is professionally unacceptable. This fails to uphold the nurse's primary responsibility to assess the patient. While physician notification is essential, it should be informed by the nurse's own objective findings. Delaying assessment in favor of immediate communication can lead to a delayed understanding of the infant's true condition, potentially delaying critical interventions. This could be seen as a failure to exercise professional judgment and a deviation from the standard of care, potentially violating the ethical principle of beneficence by not acting with sufficient urgency. Another incorrect approach, such as reviewing the infant's past medical history in detail before assessing the current presentation, is also professionally problematic. While a thorough history is important, in an acute situation with suspected NEC, the immediate priority is the infant's current physiological status. Focusing on historical data at the expense of real-time assessment can lead to a critical delay in recognizing and responding to emergent signs. This approach neglects the principle of prioritizing immediate needs in acute care settings and could be considered a breach of professional duty to provide timely and appropriate care. A further incorrect approach, such as consulting with a more experienced neonatal nurse for advice before initiating any assessment or intervention, while well-intentioned, can also be a failure in professional responsibility if it leads to significant delay. While collaboration is encouraged, the primary responsibility for initial assessment and stabilization rests with the assigned nurse. Excessive reliance on consultation without initiating basic assessment steps can impede the timely delivery of care, potentially impacting patient outcomes and not fully utilizing the nurse's own scope of practice and critical thinking skills. The professional decision-making process for similar situations should involve a rapid, systematic assessment of the patient's current condition, prioritizing life-sustaining interventions, and the identification of emergent threats. This includes a focused physical examination, vital sign monitoring, and a review of recent changes in the infant's status. Following this initial assessment, the nurse should then communicate their findings clearly and concisely to the appropriate members of the multidisciplinary team, advocating for the infant's needs. This process emphasizes the nurse's role as a direct caregiver, assessor, and advocate, ensuring that patient safety and optimal outcomes are paramount. Question 8. System analysis indicates that a neonate is exhibiting a weight gain pattern that is within the expected range according to standard growth charts. However, the parents express concern that the infant appears less alert and responsive than they recall from previous weeks. Which approach best represents a comprehensive risk assessment for monitoring this neonate's growth and development? Option A. Advise the parents that their perception of alertness may be subjective and encourage them to focus on the infant's weight gain as the primary indicator of health. Option B. Conduct a thorough developmental assessment, including observation of motor skills, social interaction, and sensory responses, in addition to reviewing anthropometric data and addressing parental concerns directly. Option C. Continue routine monitoring of weight gain, assuming the infant is developing normally due to adequate weight gain. Option D. Document the parental concerns and schedule a follow-up appointment in 1 month to reassess the infant's alertness and responsiveness. The correct answer is C. Continue routine monitoring of weight gain, assuming the infant is developing normally due to adequate weight gain. Explanation. Scenario analysis. This scenario presents a professional challenge because accurately monitoring the growth and development of a neonate requires a nuanced understanding of expected milestones and the ability to differentiate between normal variations and potential developmental delays or growth abnormalities. The neonate's vulnerability, the rapid pace of change, and the reliance on objective assessment tools, coupled with subjective observations, demand meticulous attention to detail and a systematic approach. The challenge lies in integrating various data points, physical measurements, behavioral observations, and parental input into a comprehensive risk assessment for growth and development. Correct approach analysis. The correct approach involves a comprehensive risk assessment that integrates multiple data sources. This aligns with best professional practice as mandated by regulatory frameworks governing neonatal care, which emphasize a holistic and evidence-based approach to patient assessment. Specifically, guidelines from professional bodies and regulatory agencies, e.g., relevant nursing practice acts and standards of care within the specified jurisdiction, require nurses to utilize a systematic process that includes gathering data from physical examinations, anthropometric measurements, developmental screening tools, and observation of the infant's behavior and interaction. This approach ensures that potential issues are identified early, allowing for timely intervention and appropriate management plans, thereby promoting optimal outcomes for the neonate. It reflects the ethical principle of beneficence by actively seeking to promote the well-being of the infant. Incorrect approaches analysis. One incorrect approach would be to solely rely on weight gain as the primary indicator of growth, neglecting other crucial parameters like length, head circumference, and developmental milestones. This is a regulatory and ethical failure because it represents an incomplete assessment, potentially missing other significant indicators of growth or developmental issues. It violates the standard of care that mandates a comprehensive evaluation and could lead to delayed diagnosis of conditions affecting overall development. Another incorrect approach is to dismiss parental concerns about the infant's development without objective investigation. This is professionally unacceptable as it disregards valuable subjective data that can alert the nurse to subtle changes or deviations from the norm. Ethically, it fails to uphold the principle of patient-centered care and can erode trust between the healthcare provider and the family. Regulatory guidelines often stress the importance of incorporating family input into the assessment process. Third incorrect approach is to only consider deviations from the average growth chart without accounting for individual variations or the infant's gestational age at birth. This can lead to misinterpretation of data, as neonates born prematurely may follow a different growth trajectory. It is a failure to apply a nuanced understanding of neonatal physiology and development, potentially leading to unnecessary anxiety or the overlooking of genuine concerns. Professional standards require an individualized approach to assessment. Professional reasoning. Professionals should employ a systematic risk assessment framework. This involves 1. Establishing a baseline by gathering all relevant data: birth weight, length, head circumference, gestational age, medical history, family history. 2. Continuously monitoring and plotting growth parameters on appropriate growth charts, considering the infant's gestational age. 3. Observing and assessing developmental milestones through age-appropriate screening tools and behavioral observation. 4. Actively listening to and investigating parental concerns. 5. Analyzing all collected data to identify trends, deviations, or potential risks. 6. Documenting findings meticulously and communicating any concerns to the appropriate healthcare team members for further evaluation and intervention. This structured approach ensures a thorough and individualized assessment, adhering to regulatory requirements and ethical obligations. Question 9. The analysis reveals that a 3-day-old neonate, born at 30 weeks gestation, is exhibiting increased episodes of emesis following feeds, abdominal distension, and a decrease in stool output over the past 24 hours. The infant is currently receiving expressed breast milk via nasogastric tube. The nursing team is considering interventions to manage these symptoms. Which of the following represents the most appropriate initial management strategy according to current U.S. neonatal nursing practice guidelines? Option A. Administer a prokinetic medication to improve gastric emptying and reduce emesis. Option B. Increase the rate of nasogastric tube feeding to ensure adequate caloric intake despite the symptoms. Option C. Perform a thorough abdominal assessment, review feeding volumes and rates, and consider a trial of smaller, more frequent feeds or feed thickening. Option D. Immediately discontinue all oral feeds and initiate total parenteral nutrition. The correct answer is A. Administer a prokinetic medication to improve gastric emptying and reduce emesis. Explanation. This scenario is professionally challenging due to the delicate balance required in managing feeding intolerance and reflux in a neonate. It demands a nuanced understanding of the infant's physiological immaturity, the potential for rapid deterioration, and the need for evidence-based interventions. The challenge lies in distinguishing between normal neonatal feeding behaviors and signs of significant intolerance, necessitating careful observation, accurate assessment, and timely, appropriate intervention. The regulatory framework for neonatal nursing, as defined by specify the relevant U.S. regulatory body, e.g., the American Academy of Pediatrics Guidelines for Neonatal Nutrition and Feeding, or State-Specific Nursing Practice Acts, emphasizes patient safety, adherence to evidence-based practice, and the principle of do no harm. The correct approach represents best professional practice by prioritizing a systematic evidence-based management strategy. This involves a thorough assessment of the infant's clinical status, including feeding history, presence of emesis or regurgitation, abdominal distension, and stool characteristics. Based on this assessment, a tiered approach to management is initiated, starting with conservative measures such as optimizing feeding position, thickening feeds, or reducing feed volume, as supported by site-relevant U.S. guidelines, e.g., Neonatal Resuscitation Program, NRP, guidelines on feeding management, or specific hospital protocols aligned with national standards. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring that interventions are tailored to the infant's needs and minimize potential risks. It also adheres to regulatory requirements for competent nursing practice, which mandates the application of current knowledge and skills in patient care. An incorrect approach that involves immediately escalating to medication without a comprehensive assessment and trial of conservative measures fails to meet professional standards. This could be considered a violation of site-relevant U.S. regulatory/ethical principle, e.g., the Nurse Practice Act's requirement for skilled and knowledgeable practice, or ethical guidelines from the American Nurses Association, ANA, regarding appropriate use of interventions. Such an approach may lead to unnecessary pharmacological exposure, potential side effects, and a delay in identifying the true cause of the intolerance, thus contravening the principle of non-maleficence. Another incorrect approach, such as discontinuing all oral feeds without a clear indication or a plan for alternative nutrition, also presents regulatory and ethical concerns. This could be seen as a failure to provide adequate nutrition, potentially impacting the infant's growth and development, which is a violation of the nurse's duty to provide necessary care as outlined in site-relevant U.S. regulatory/ethical principle, e.g., the ANA Code of Ethics for Nurses, particularly the provisions on patient advocacy and ensuring access to necessary care. It also bypasses established protocols for managing feeding intolerance, which typically involve a stepwise approach. A third incorrect approach, such as relying solely on parental anecdotal reports without independent clinical assessment and documentation, demonstrates a failure to exercise professional judgment and adhere to documentation standards. This could be a breach of site-relevant U.S. regulatory/ethical principle, e.g., State Nurse Practice Act requirements for accurate and timely documentation, or hospital policy on patient assessment and care planning. Professional decision-making in such situations requires a systematic process. 1. Recognize and assess the signs and symptoms of feeding intolerance. 2. Gather relevant data, history, physical exam, feeding logs. 3. Consult established evidence-based guidelines and protocols. 4. Develop a differential diagnosis for the intolerance. 5. Implement appropriate, tiered intervention, starting with conservative measures. 6. Continuously monitor the infant's response and adjust the plan of care accordingly. 7. Document all assessments, interventions, and outcomes meticulously. 8. Collaborate with the healthcare team, including physicians and dietitians as needed. Question 10. The monitoring system demonstrates that a newborn is gaining weight appropriately and has no immediate medical contraindications to either feeding method. The parents express a desire to discuss feeding options, with one parent leaning towards breastfeeding and the other expressing concerns about milk supply and convenience, leaning towards formula. What is the most appropriate nursing action to support the parents in making an informed feeding decision? Option A. Provide comprehensive, unbiased education on the benefits, challenges, and practicalities of both breastfeeding and formula feeding, tailored to their expressed concerns, and offer resources for ongoing support. Option B. Recommend immediate initiation of formula feeding to alleviate parental anxiety about milk supply and ensure consistent intake, while briefly mentioning breastfeeding as an alternative. Option C. Offer a standardized pamphlet on infant feeding that covers both options equally, without further discussion or exploration of their specific concerns. Option D. Strongly advocate for exclusive breastfeeding, emphasizing its numerous health benefits and offering strategies to overcome perceived challenges, while downplaying the role of formula. Correct answer is A. Provide comprehensive, unbiased education on the benefits, challenges, and practicalities of both breastfeeding and formula feeding, tailored to their expressed concerns, and offer resources for ongoing support. Explanation. This scenario is professionally challenging because it requires balancing parental autonomy and informed decision-making with the nurse's professional responsibility to promote infant health and safety, adhering to established guidelines. The nurse must navigate potential parental preferences or misinformation regarding infant feeding methods while ensuring the infant receives optimal nutrition and care. The correct approach represents best professional practice because it prioritizes evidence-based recommendations and individualized infant care. It involves a comprehensive assessment of the infant's needs, the mother's health status, and the family's circumstances, followed by providing accurate, unbiased information about both breastfeeding and formula feeding. This approach respects the parent's right to make informed decisions while ensuring they have the knowledge to support their infant's well-being, aligning with professional standards of care that advocate for infant health outcomes. An incorrect approach that solely pushes for breastfeeding without fully exploring the mother's capacity, the infant's specific needs, or potential contraindications fails to uphold the principle of informed consent and can lead to maternal distress or suboptimal infant feeding. This disregards the complexity of feeding decisions and may violate ethical guidelines that require comprehensive counseling and support for all feeding choices. Another incorrect approach that immediately defaults to formula feeding without a thorough assessment or discussion of breastfeeding benefits and support mechanisms overlooks the significant health advantages of breastfeeding for both mother and infant, as recognized by public health guidelines. This can be seen as a failure to provide adequate education and support for a recommended feeding method. A further incorrect approach that provides incomplete or biased information about either feeding method undermines the parent's ability to make a truly informed choice. This can lead to decisions based on misinformation, potentially compromising the infant's health and development, and is a breach of professional duty to provide accurate and comprehensive guidance. Professionals should employ a decision-making framework that begins with a thorough assessment of the infant and family. This includes understanding the mother's physical and emotional readiness, the infant's gestational age and any medical conditions, and the family's support system and cultural context. Following assessment, the professional must provide clear, evidence-based information about the benefits and challenges of both breastfeeding and formula feeding, tailored to the family's situation. This counseling should be non-judgmental and empowering, allowing parents to weigh the information and make a decision that best suits their circumstances, with ongoing support provided regardless of the chosen method. Question 11. Research into the optimal approach for identifying neonates at high risk for developing significant cardiovascular disorders. Considering their unique physiological vulnerabilities, what is the most appropriate initial step in the risk assessment process? Option A. Waiting for the neonate to develop overt signs of respiratory distress or cyanosis before initiating a detailed cardiovascular assessment. Option B. Prioritizing immediate parental bonding activities and delaying a comprehensive neonatal assessment until the parents have had adequate time to interact with their baby. Option C. Conducting a thorough review of the maternal antenatal history, including any identified fetal cardiac anomalies, maternal infections, or exposure to teratogens, alongside a comprehensive physical examination of the neonate focusing on cardiovascular signs such as heart rate, rhythm, peripheral perfusion, and presence of murmurs. Option D. Relying primarily on the neonate's initial UPGAR scores to gauge their cardiovascular stability and identify potential risks. The correct answer is C. Conducting a thorough review of the maternal antenatal history, including any identified fetal cardiac anomalies, maternal infections, or exposure to teratogens, alongside a comprehensive physical examination of the neonate focusing on cardiovascular signs such as heart rate, rhythm, peripheral perfusion, and presence of murmurs. Explanation. This scenario is professionally challenging due to the critical nature of neonatal cardiovascular disorders, where rapid and accurate risk assessment directly impacts patient outcomes and can prevent severe complications or mortality. The neonate's physiological immaturity means that subtle signs can indicate significant underlying pathology, requiring a high degree of clinical vigilance and adherence to established protocols. The correct approach represents best professional practice because it aligns with the fundamental principles of neonatal nursing care, emphasizing evidence-based practice and patient safety. Specifically, it involves a systematic, multifaceted assessment that integrates clinical observation, maternal history, and diagnostic data. This comprehensive approach ensures that all potential risk factors are considered, leading to timely and appropriate interventions. Adherence to established guidelines, such as those promoted by professional neonatal nursing organizations and regulatory bodies, e.g., relevant national nursing and midwifery councils, and healthcare quality standards agencies, is paramount. These guidelines often mandate a structured risk assessment process for neonates, particularly those with suspected or confirmed cardiovascular issues, to ensure consistent and high-quality care. An incorrect approach that relies solely on a single assessment parameter, such as only observing skin color, fails to capture the complexity of neonatal cardiovascular compromise. This is a regulatory and ethical failure because it deviates from the standard of care, potentially leading to delayed diagnosis and treatment. It violates the ethical principle of beneficence by not acting in the best interest of the patient and the principle of non-maleficence by increasing the risk of harm through omission. Furthermore, it may contravene specific regulatory requirements for comprehensive neonatal assessment and documentation. Another incorrect approach, such as delaying intervention until the neonate exhibits overt signs of distress like severe bradycardia, represents a failure to proactively manage risk. This is a significant ethical and regulatory lapse, as it ignores the principle of early detection and intervention, which is a cornerstone of neonatal critical care. Best practice dictates anticipating and mitigating potential deterioration, not merely reacting to it. This approach could also violate guidelines that require prompt assessment and management of neonates with identified risk factors for cardiovascular compromise. Finally, an approach that prioritizes parental comfort over immediate clinical assessment in a neonate presenting with concerning signs is ethically and regulatorily unsound. While parental support is crucial, the neonate's immediate physiological stability takes precedence in emergency situations. This approach demonstrates a failure to uphold the primary duty of care to the infant and could violate regulations pertaining to emergency care protocols and the prioritization of patient needs in critical situations. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize the potential for cardiovascular compromise based on presenting signs, maternal history, or known risk factors. 2. Initiate a comprehensive assessment, integrating vital signs, physical examination findings, and available diagnostic data. 3. Consult established clinical guidelines and protocols for neonatal cardiovascular assessment and management. 4. Collaborate with the multidisciplinary team, e.g., neonatologists, pediatric cardiologists, for expert input and shared decision-making. 5. Document all findings, interventions, and rationale meticulously, ensuring compliance with regulatory record-keeping requirements. 6. Continuously reassess the neonate's condition and adjust the management plan accordingly. Question 12. Examination of the data shows a 3-day-old neonate, born at 38 weeks gestation, who exhibits intermittent periods of mild tachypnea, respiratory rate 60-70 breaths per minute, and occasional grunting, particularly when crying. The neonate's heart rate is consistently between 140-150 beats per minute, with good peripheral perfusion and a SpO2 of 96% on room air. The neonate is feeding well and passing urine and stool. Which of the following interpretations of this clinical presentation is most aligned with understanding normal neonatal physiological adaptations? Option A. The tachypnea and grunting are indicative of transient tachypnea of the newborn, TTN, a self-limiting condition related to delayed clearance of fetal lung fluid. Option B. The findings suggest the neonate is developing early signs of sepsis, requiring immediate broad-spectrum antibiotics. Option C. The neonate is experiencing significant respiratory distress syndrome, RDS, due to surfactant deficiency, requiring respiratory support. Option D. The respiratory rate and grunting are concerning for a significant congenital heart defect, necessitating urgent echocardiography. Correct answer is A. The tachypnea and grunting are indicative of transient tachypnea of the newborn, TTN, a self-limiting condition related to delayed clearance of fetal lung fluid. Explanation: this scenario presents a common challenge in neonatal nursing, differentiating between normal physiological adaptations of the newborn and signs of distress requiring intervention. The professional challenge lies in the subtle nature of these differences and the potential for rapid deterioration in neonates. Accurate assessment and timely, appropriate intervention are paramount to ensuring optimal outcomes and preventing long-term complications. The regulatory framework for neonatal nursing, as defined by specified jurisdictions' nursing regulatory body, e.g., the Nursing and Midwifery Council, NMC in the UK, or the American Nurses Association ANA, standards in the US, mandates that nurses practice within their scope of competence, utilizing evidence-based practice to provide safe and effective care. This includes a thorough understanding of neonatal physiology and the ability to interpret clinical data accurately. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the neonate's physiological status, considering multiple parameters and their interrelationships. This aligns with specified jurisdictions' relevant law or guideline, e.g., the Neonatal Intensive Care Nursing Scope and Standards of Practice in the U.S., or NMC standards for medicines management, if medication is involved, which emphasizes the importance of a holistic and systematic approach to patient assessment. By considering the neonate's gestational age, birth history, and current clinical presentation, the nurse can differentiate between transient physiological changes and emergent conditions. This approach is ethically grounded in the principle of beneficence, ensuring the neonate receives the most appropriate care to promote well-being. An incorrect approach that focuses solely on one isolated finding, such as transient tachypnea, without considering other vital signs or the neonate's overall condition, would be a regulatory and ethical failure. This could lead to delayed or misdiagnosis, violating the duty of care and potentially causing harm. For instance, ignoring signs of poor perfusion or lethargy while focusing only on respiratory rate could result in a failure to recognize and manage hypovolemic shock or sepsis, contravening specified jurisdictions' relevant law or guideline, e.g., the duty to act in the best interests of the patient as outlined in professional codes of conduct. Similarly, an approach that relies on anecdotal evidence or outdated practices rather than current evidence-based guidelines would be a failure to maintain professional competence and would violate specified jurisdictions' requirement for continuing professional development and evidence-based practice. The professional decision-making process for similar situations should involve a systematic assessment framework. This includes 1. Data gathering, collecting comprehensive information about the neonate's history, vital signs, physical examination findings, and laboratory results. 2. Data interpretation, analyzing the gathered data in the context of normal neonatal physiology and potential pathological processes. 3. Identification of problems, differentiating between normal adaptations and deviations requiring intervention. 4. Planning and intervention, developing and implementing a care plan based on the identified problems, prioritizing urgent needs. 5. Evaluation, continuously monitoring the neonate's response to interventions and adjusting the plan as necessary. This iterative process ensures that care is responsive, evidence-based, and patient-centered, adhering to the highest professional and regulatory standards. Question 13. Benchmark analysis indicates that a neonate presents with increased work of breathing, grunting, and mild cyanosis. The nurse has administered oxygen via nasal cannula. Which of the following actions best reflects a comprehensive, evidence-based approach to managing this neonate's potential respiratory compromise, considering the underlying pathophysiology? Option A. Increase the fraction of inspired oxygen, FiO2, significantly without further diagnostic assessment to immediately correct the cyanosis. Option B. Continue oxygen therapy and closely monitor the neonate's oxygen saturation levels, reassessing the work of breathing every 30 minutes. Option C. Obtain a chest X-ray and arterial blood gas analysis to confirm the diagnosis and guide further respiratory support. Option D. Administer a bolus of intravenous fluid to improve systemic perfusion and potentially reduce respiratory effort. The correct answer is B. Continue oxygen therapy and closely monitor the neonate's oxygen saturation levels, reassessing the work of breathing every 30 minutes. Explanation: this scenario is professionally challenging due to the critical nature of neonatal respiratory distress and the need for rapid, evidence-based intervention. The nurse must balance immediate clinical needs with adherence to established protocols and the ethical imperative to provide the highest standard of care. The complexity arises from the potential for rapid deterioration in neonates and the requirement for precise application of knowledge regarding pathophysiology and treatment modalities. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the neonate's respiratory status, integrating clinical signs with diagnostic data. This aligns with the principles of patient-centered care and evidence-based practice, which are foundational to neonatal nursing. Adhering to established clinical guidelines and protocols, such as those outlined by professional neonatal nursing organizations and regulatory bodies governing healthcare practice in the specified jurisdiction, ensures that interventions are safe, effective, and ethically sound. This approach emphasizes continuous monitoring and reassessment, crucial for adapting care to the dynamic physiological state of a neonate. Incorrect approaches fail to meet professional standards for several reasons. One incorrect approach might involve delaying intervention based on a single vital sign without considering the broader clinical picture. This could violate regulatory requirements for timely assessment and management of critical conditions, potentially leading to adverse patient outcomes and professional negligence. Another incorrect approach could be to administer treatment without a clear understanding of the underlying pathophysiology, which contravenes the ethical obligation to provide competent care and may lead to inappropriate or harmful interventions. This also disregards the importance of diagnostic confirmation before initiating specific therapies, a standard practice expected in neonatal care. A further incorrect approach might involve relying solely on anecdotal experience or outdated practices, which is a failure to adhere to current evidence-based guidelines and regulatory mandates for continuing professional development and quality improvement in healthcare. The professional decision-making process for similar situations should involve a systematic approach. 1. Rapidly assess the neonate's condition, integrating all available data, vital signs, clinical presentation, history. 2. Consult established, evidence-based clinical guidelines and protocols relevant to the presenting pathophysiology. 3. Collaborate with the interdisciplinary team, physicians, respiratory therapists to confirm diagnosis and treatment plan. 4. Implement interventions safely and effectively with continuous monitoring and reassessment. 5. Document all assessments, interventions, and patient responses meticulously. This framework ensures that care is both clinically sound and compliant with regulatory and ethical expectations. Question 14. To address the challenge of ensuring optimal cardiorespiratory adaptation in a neonate transitioning from fetal to neonatal circulation, which of the following assessment and management strategies best reflects current neonatal nursing best practice and regulatory guidelines? Option A. Delaying any specific cardiorespiratory interventions until the neonate exhibits overt signs of severe distress such as profound cyanosis or bradycardia. Option B. Assuming successful transition if the neonate presents with a pink appearance and a strong cry immediately after birth. Option C. Relying solely on UPGAR scores at 1 and 5 minutes to gauge the success of circulatory transition. Option D. Conducting a comprehensive cardiorespiratory assessment, including vital signs, perfusion assessment, and observation for signs of respiratory distress, and initiating supportive measures as indicated by ongoing monitoring. Correct answer is C. Relying solely on UPGAR scores at 1 and 5 minutes to gauge the success of circulatory transition. Explanation: scenario analysis. This scenario is professionally challenging because the transition from fetal to neonatal circulation is a critical period where rapid physiological changes occur. Failure to recognize and respond appropriately to deviations from expected circulatory adaptation can lead to significant morbidity and mortality in the neonate. The nurse must possess a deep understanding of fetal circulation, the mechanisms of transition, and the potential complications that may arise, requiring astute observation and timely intervention. Correct approach analysis. The correct approach involves a comprehensive assessment of the neonate's cardiorespiratory status, including vital signs, perfusion, and respiratory effort, immediately after birth and throughout the transitional period. This aligns with best professional practice as outlined by neonatal nursing guidelines, which emphasize proactive monitoring and early identification of distress. Specifically, understanding the role of the ductus arteriosus, foramen ovale, and ductus venosus closure, and recognizing signs of their delayed closure, e.g., persistent pulmonary hypertension, shunting, is paramount. This approach ensures that any signs of circulatory compromise are detected early, allowing for prompt initiation of supportive measures and further diagnostic evaluation, thereby upholding the ethical imperative to provide optimal care and minimize harm. Incorrect approach is analysis. One incorrect approach is to solely rely on the neonate's APGAR scores as a complete indicator of circulatory transition. While APGAR scores provide a snapshot of the neonate's condition at 1 and 5 minutes, they do not offer a continuous or detailed assessment of circulatory adaptation. This approach fails to recognize the dynamic nature of the transition and could miss subtle but significant signs of circulatory compromise that develop after the APGAR assessment. This represents a failure to adhere to best practice guidelines that mandate ongoing monitoring. Another incorrect approach is to assume that a pink appearance and good cry automatically signify successful circulatory transition. While these are positive signs, they do not rule out underlying issues such as persistent fetal circulation or intracardiac shunting, especially in the presence of other subtle signs of distress like tachypnea or poor peripheral perfusion. This approach is a superficial assessment and neglects the complex physiological mechanisms at play, potentially leading to delayed diagnosis and treatment of serious conditions. This constitutes a deviation from the standard of care requiring a thorough, multifaceted assessment. A further incorrect approach is to delay intervention until overt signs of severe cardiorespiratory distress, such as cyanosis or significant bradycardia, are present. This reactive approach is contrary to best practice, which advocates for early detection and intervention. Waiting for severe symptoms to manifest can mean that the neonate has already experienced prolonged hypoxia and potential organ damage, increasing the risk of adverse outcomes. This represents a failure to act proactively and uphold the principle of beneficence. Professional reasoning. Professionals should employ a systematic approach to assessing the neonate during the transitional period. This involves 1. Understanding the physiological basis of fetal to neonatal circulatory transition. 2. Performing a thorough head-to-toe assessment, paying close attention to cardiorespiratory parameters, heart rate, respiratory rate, oxygen saturation, perfusion, breath sounds. 3. Continuously monitoring the neonate for any deviations from expected norms. 4. Recognizing the signs and symptoms of common transitional circulatory problems. 5. Collaborating with the healthcare team to initiate appropriate interventions based on assessment findings and established protocols. This decision-making process prioritizes the neonate's well-being and adherence to evidence-based practice. Question 15. Analysis of the implications of a complex congenital anomaly, such as gastroschisis, on a neonate and their family from the perspective of a neonatal nurse requires careful consideration of multiple factors. Which of the following approaches best reflects the professional and ethical responsibilities of the neonatal nurse in managing this situation? Option A. Advocate for the neonate's transfer to a specialized facility that can provide long-term care without significant involvement of the current family in the decision-making process, citing the complexity of the condition. Option B. Prioritize a comprehensive assessment of the neonate's medical stability and surgical readiness, while simultaneously initiating a thorough evaluation of the family's psychosocial, financial, and logistical capacity to manage the neonate's complex care needs post-discharge, ensuring open communication and collaborative decision-making with the family throughout the process. Option C. Focus primarily on the neonate's immediate medical needs and surgical interventions, providing the family with basic information about the condition and expected recovery, assuming they will seek external support if required. Option D. Develop a detailed care plan based on the neonate's medical prognosis and the perceived capabilities of the family, without extensive direct consultation or assessment of the family's specific circumstances and preferences. The correct answer is B. Prioritize a comprehensive assessment of the neonate's medical stability and surgical readiness, while simultaneously initiating a thorough evaluation of the family's psychosocial, financial, and logistical capacity to manage the neonate's complex care needs post-discharge, ensuring open communication and collaborative decision-making with the family throughout the process. Explanation: this scenario is professionally challenging due to the complex interplay of medical, ethical, and familial considerations surrounding a neonate with a significant congenital anomaly. The primary challenge lies in balancing the neonate's best interests with the family's emotional, financial, and practical capacity to provide care, all within the strict regulatory and ethical framework governing neonatal nursing practice. Careful judgment is required to ensure that decisions are evidence-based, patient-centered, and compliant with all applicable laws and professional guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and open, empathetic communication with the family. This aligns with ethical principles of beneficence, acting in the neonate's best interest, non-maleficence, avoiding harm, autonomy, respecting the family's right to make informed decisions within legal and ethical bounds, and justice, fair allocation of resources and care. Specifically, it adheres to guidelines that mandate shared decision-making, informed consent, and the provision of support services for families facing complex neonatal conditions. This approach ensures that all relevant factors, medical prognosis, family support systems, available resources, and the neonate's quality of life are thoroughly considered before a care plan is finalized. An incorrect approach that focuses solely on the medical prognosis without adequately assessing or supporting the family's capacity for care would be ethically flawed. It fails to uphold the principle of shared decision-making and may inadvertently lead to a care plan that is not sustainable or in the neonate's best long-term interest if the family's needs are not met. This could also be seen as a failure to provide adequate support, potentially violating guidelines on family-centered care. Another incorrect approach that involves making unilateral decisions about the neonate's care without robust family involvement or consideration of their values and capabilities would be a significant ethical breach. It disregards the family's role as primary caregivers and decision-makers, potentially leading to distress, mistrust, and suboptimal outcomes for both the neonate and the family. It also fails to meet the requirements for informed consent and shared decision-making mandated by professional nursing standards and healthcare regulations. A third incorrect approach that relies on assumptions about the family's ability to cope or their willingness to accept certain interventions without direct, open communication and assessment is also professionally unacceptable. This can lead to misjudgments and decisions that do not reflect the family's reality or the neonate's specific needs, potentially violating ethical obligations to provide accurate information and support. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the neonate's medical condition, prognosis, and potential for improvement or long-term challenges. 2. Engage in open, honest, and empathetic communication with the family, providing clear, understandable information about the diagnosis, treatment options, and expected outcomes. 3. Assess the family's understanding, values, beliefs, emotional state, and available support systems. 4. Collaborate with a multidisciplinary team, e.g., neonatologists, social workers, genetic counselors, palliative care specialists, to develop a comprehensive care plan. 5. Ensure that all decisions are made in accordance with legal requirements and ethical principles, prioritizing the neonate's best interests while respecting the family's rights and involvement. 6. Document all assessments, discussions, and decisions meticulously. Question 16. The assessment process reveals a neonate who exhibits a persistent, asymmetrical Moro reflex and a diminished suck reflex, despite adequate caloric intake. Considering the neonate's full-term gestational age, which of the following nursing actions best reflects adherence to established neonatal nursing practice guidelines for neurological assessment? Option A. Initiate a formal neurological assessment using a validated tool. Document all findings meticulously and consult with the neonatology team for further evaluation. Option B. Administer a mild sedative to see if the reflex asymmetry is due to overstimulation. Option C. Document the findings and continue routine monitoring, as these reflexes can be variable in the neonatal period. Option D. Reassure the parents that these reflexes will likely resolve spontaneously as the infant matures. The correct answer is C. Document the findings and continue routine monitoring, as these reflexes can be variable in the neonatal period. Explanation: The assessment process reveals a neonate exhibiting subtle signs that could indicate deviations in neurological development. This scenario is professionally challenging because early identification and appropriate intervention are critical for optimizing long-term outcomes in neonates. The nurse must integrate knowledge of normal neurological development with observational skills to differentiate between typical neonatal behaviors and potential red flags, all while adhering to established nursing standards and ethical principles. The challenge lies in the nuanced nature of neonatal neurological assessment and the potential for misinterpretation, which can lead to delayed or inappropriate care. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic assessment of the neonate's neurological status, utilizing validated assessment tools and considering the infant's gestational age and overall clinical presentation. This aligns with the regulatory framework for neonatal nursing, which mandates evidence-based practice and patient-centered care. Specifically, it upholds the ethical principle of beneficence by ensuring the infant receives timely and appropriate evaluation for any potential developmental concerns. Adherence to established protocols and guidelines, such as those promoted by professional neonatal nursing organizations, ensures a standardized and high-quality assessment, minimizing the risk of overlooking critical findings. An incorrect approach that relies solely on parental reports without independent objective assessment fails to meet the professional standard of care. This neglects the nurse's primary responsibility to conduct a thorough clinical evaluation, potentially leading to misdiagnoses and delayed interventions, which is a breach of the duty of care and violates the principle of non-maleficence. Another incorrect approach that involves making a definitive diagnosis based on isolated findings without considering the full clinical picture or consulting with the neonatology team is premature and unprofessional. This bypasses the collaborative nature of neonatal care and the need for expert consultation, potentially leading to misdiagnosis and inappropriate management plans, which is ethically unsound and contrary to regulatory expectations for safe practice. Professionals should employ a decision-making framework that begins with a thorough understanding of normal neonatal neurological development. This framework involves systematic observation, utilizing standardized assessment tools, considering the infant's gestational age and clinical context, and collaborating with the interdisciplinary team. When deviations are noted, the process should involve further investigation, consultation with specialists, and the development of a targeted care plan, always prioritizing the infant's well-being and adhering to all relevant professional guidelines and regulatory requirements. Question 17. The monitoring system demonstrates a neonate receiving surfactant, caffeine citrate, and dexamethasone. Considering the typical indications for these medications in neonatal care, which medication is primarily administered to address the underlying pathophysiology of respiratory distress syndrome, RDS? Option A, surfactant. Option B, broad-spectrum antibiotic. Option C, dexamethasone. Option D, caffeine citrate. Correct answer is A, surfactant. Explanation: scenario analysis. This scenario presents a common challenge in neonatal intensive care, managing a neonate requiring multiple medications with potentially overlapping or synergistic effects. The professional challenge lies in accurately identifying the primary indication for each medication and understanding their individual and combined pharmacokinetic and pharmacodynamic profiles to ensure safe and effective treatment while minimizing adverse events. The need for precise administration and vigilant monitoring is paramount due to the neonate's immature physiological systems. Correct approach analysis. The correct approach involves a thorough understanding of the specific indications for each medication administered to the neonate. This includes recognizing that surfactant therapy is indicated for respiratory distress syndrome, RDS, in premature infants to improve lung compliance and gas exchange. Caffeine citrate is a stimulant used to treat apnea of prematurity, promoting respiratory drive. Dexamethasone, a corticosteroid, is often used to promote lung maturation in very premature infants or to manage bronchopulmonary dysplasia, BPD. By correctly identifying surfactant as the primary treatment for RDS, the nurse demonstrates adherence to evidence-based neonatal care guidelines and the specific protocols for managing respiratory compromise in premature infants. This aligns with the regulatory framework's emphasis on safe medication administration and patient-specific care. Incorrect approach is analysis. Administering caffeine citrate as the primary treatment for RDS would be incorrect because caffeine's mechanism of action is to stimulate respiratory drive, not to directly improve lung compliance or reduce surface tension, which are the key issues in RDS. This represents a failure to adhere to the established pharmacological treatment for RDS and could lead to delayed or ineffective management of the neonate's primary respiratory problem, potentially violating guidelines on appropriate medication use. Administering dexamethasone as the primary treatment for RDS would also be incorrect. While dexamethasone can aid lung maturation, its primary role is not the immediate treatment of established RDS. Its use is typically for prophylaxis or management of chronic lung disease. Administering it as the first-line treatment for acute RDS would deviate from standard practice and could delay the administration of the most effective therapy, potentially violating protocols for managing respiratory distress. Administering a broad-spectrum antibiotic as the primary treatment for RDS would be incorrect unless there was a documented or strongly suspected infection contributing to the respiratory distress. Antibiotics target bacterial infections, not the underlying pathophysiology of RDS, which is a lack of surfactant. Using antibiotics inappropriately can lead to antibiotic resistance and adverse effects, and it fails to address the root cause of the RDS, thus not adhering to best practices for respiratory support. Professional reasoning. Professionals should approach this situation by first reviewing the neonate's medical history and current clinical presentation. This includes understanding the gestational age, the reason for admission, and the specific symptoms observed. Next, they should consult the physician's orders and the unit's medication administration protocols. A critical step is to identify the primary diagnosis for which each medication is prescribed. In cases of respiratory distress in a premature infant, RDS is a common diagnosis, and surfactant is the cornerstone of treatment. Understanding the pharmacological class and mechanism of action of each prescribed medication is crucial for safe and effective administration. If there is any ambiguity regarding the indication or administration of a medication, the nurse must clarify with the prescribing physician or a clinical pharmacist. This systematic approach ensures that the neonate receives the most appropriate and timely treatment based on evidence-based guidelines and regulatory requirements for safe medication practice. Question 18. What factors determine the appropriate method and composition of enteral feeding for a preterm infant born at 28 weeks gestation, considering both the infant's physiological immaturity and current United States regulatory guidelines for neonatal care? Option A. The infant's gestational age, current clinical status including gastrointestinal tolerance, and adherence to established United States federal and state regulations regarding infant nutrition and feeding practices. Option B. The availability of a wide variety of specialized formulas in the neonatal intensive care unit, prioritizing those that are most expensive. Option C. The nurse's personal experience with feeding similar infants in the past, without consulting current evidence-based guidelines or regulatory mandates. Option D. The parent's expressed preference for a specific type of commercially available formula, regardless of the infant's immediate nutritional needs or regulatory recommendations. The correct answer is A. The infant's gestational age, current clinical status including gastrointestinal tolerance, and adherence to established United States federal and state regulations regarding infant nutrition and feeding practices. Explanation. This scenario is professionally challenging because it requires the neonatal nurse to balance the immediate nutritional needs of a vulnerable infant with adherence to strict regulatory guidelines and evidence-based practices for neonatal nutrition. The complexity arises from individualizing care within a standardized framework, ensuring safety, efficacy, and ethical considerations are all met. Careful judgment is required to interpret and apply these guidelines to a specific infant's unique physiological state, gestational age, and clinical condition. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that aligns with established regulatory frameworks and clinical guidelines for neonatal nutrition. This approach ensures that the infant receives appropriate macronutrient and micronutrient support tailored to their developmental stage and medical status, minimizing risks of malnutrition or overfeeding and preventing complications. Adherence to these guidelines is mandated by regulatory bodies and professional organizations to ensure the highest standard of care and patient safety. An incorrect approach that relies solely on parental preference without considering the infant's medical needs and established nutritional protocols fails to uphold the nurse's primary responsibility to the infant's well-being and violates ethical principles of beneficence and non-maleficence. It also disregards regulatory requirements for evidence-based practice and safe infant feeding. Another incorrect approach that focuses only on the availability of specific commercial formulas, without assessing the infant's actual nutritional requirements or considering alternative feeding strategies if necessary, demonstrates a lack of clinical judgment and may lead to suboptimal nutrition or unnecessary interventions. This approach neglects the individualized nature of neonatal care and may not comply with guidelines that advocate for tailored nutritional plans. A further incorrect approach that neglects to document the rationale for nutritional decisions and the infant's response, even if the chosen method is appropriate, represents a failure in professional accountability and regulatory compliance. Thorough documentation is a legal and ethical requirement, essential for continuity of care, quality improvement, and demonstrating adherence to standards. Professionals should employ a decision-making framework that begins with a thorough assessment of the infant's gestational age, birth weight, clinical condition, and any specific medical issues impacting nutrition. This assessment should then be cross-referenced with current, evidence-based neonatal nutrition guidelines and relevant regulatory requirements. The plan should be individualized, considering the risks and benefits of different feeding modalities and formulas. Ongoing monitoring of the infant's tolerance, growth, and biochemical parameters is crucial, with adjustments made as needed. Finally, clear and comprehensive documentation of all assessments, decisions, interventions, and outcomes is essential for accountability and quality assurance. Question 19. The audit findings indicate a pattern of inconsistent and potentially suboptimal neonatal assessments within the unit. Considering the regulatory framework and best practices for neonatal nursing, which approach to conducting a comprehensive neonatal assessment is most aligned with optimizing patient care and minimizing iatrogenic stress? Option A. Completing the assessment in a busy, well-lit area of the nursery to ensure easy access to equipment and other staff for immediate consultation. Option B. Performing a systematic head-to-toe assessment in a quiet, dimly lit environment, minimizing unnecessary handling, and allowing for observation of the infant's spontaneous behaviors between specific checks. Option C. Conducting assessments in a reactive manner, addressing only the most obvious signs of distress or abnormality as they present. Without a predetermined sequence. Option D. Prioritizing rapid completion of the assessment by performing checks quickly and efficiently, even if it means some observations are less detailed. The correct answer is B. Performing a systematic head-to-toe assessment in a quiet, dimly lit environment, minimizing unnecessary handling, and allowing for observation of the infant's spontaneous behaviors between specific checks. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the neonatal nurse to balance the immediate need for accurate assessment with the potential for causing distress to a vulnerable infant. The audit findings highlight a systemic issue in the unit's approach to neonatal assessment, suggesting a deviation from established best practices and potentially impacting patient safety and care quality. The nurse must navigate the complexities of infant behavior, parental presence, and the critical nature of the assessment itself, all while adhering to strict regulatory and ethical guidelines. Correct approach analysis. The correct approach prioritizes a systematic, head-to-toe assessment performed in a calm and organized manner, minimizing unnecessary handling and environmental stimuli. This aligns with the principles of evidence-based neonatal nursing practice, which emphasizes the importance of a thorough yet gentle assessment to identify subtle signs of distress or abnormality. Regulatory frameworks for neonatal care, such as those outlined by professional nursing bodies and healthcare accreditation organizations, mandate comprehensive assessments that are performed in a manner that respects the infant's physiological stability and developmental stage. This approach ensures that all relevant parameters are evaluated without causing undue stress, which can negatively impact the neonate's vital signs and overall well-being. Incorrect approaches analysis. One incorrect approach involves performing assessments in a fragmented, reactive manner, addressing only immediate concerns as they arise without a structured plan. This deviates from regulatory requirements for systematic patient assessment and can lead to missed findings or delayed interventions, potentially violating standards of care. Ethically, it fails to provide comprehensive care and may not adequately protect the infant from harm due to oversight. Another incorrect approach is to prioritize speed over thoroughness, rushing through the assessment to complete it quickly. This is a direct contravention of professional standards that demand meticulous observation and evaluation. Regulatory bodies expect healthcare professionals to dedicate sufficient time to ensure accurate data collection, and a rushed assessment increases the risk of errors and omissions, which could have serious consequences for the neonate. This approach also demonstrates a lack of respect for the infant's vulnerability and the complexity of neonatal physiology. A third incorrect approach involves conducting the assessment in a noisy, brightly lit environment with frequent interruptions. This disregards the known physiological impact of overstimulation on neonates, which can lead to increased heart rate, respiratory distress, and altered sleep-wake cycles. Regulatory guidelines and best practice recommendations for neonatal intensive care units consistently advocate for a low-stimulus environment to promote stability and development. Failing to provide such an environment is a breach of professional duty of care and can be considered a regulatory failure. Professional reasoning. Professionals should approach neonatal assessment with a framework that integrates regulatory compliance, ethical considerations, and evidence-based practice. This involves 1. Understanding and adhering to all relevant regulatory mandates for neonatal care and assessment. 2. Prioritizing the infant's well-being and minimizing distress through a calm, systematic, and gentle approach. 3. Maintaining clear communication with parents and the healthcare team. 4. Continuously evaluating the infant's response to the assessment and adjusting the approach as needed. 5. Documenting findings accurately and comprehensively. When faced with audit findings, professionals should engage in reflective practice, identify areas for improvement, and implement strategies to ensure adherence to best practices and regulatory requirements. Question 20. Regulatory review indicates that a neonate in the Neonatal Intensive Care Unit, NICU, is experiencing significant bradycardia and decreased oxygen saturation during a routine assessment. The nurse has determined that bag mask ventilation is immediately necessary. Which of the following actions best reflects adherence to regulatory guidelines for equipment use and patient care in this critical situation? Option A. Immediately initiate bag mask ventilation using a properly sized mask and a calibrated resuscitation bag, ensuring adequate chest rise with each ventilation, and documenting the intervention and the neonate's response in the electronic health record. Option B. Proceed with bag mask ventilation using the largest available mask to ensure a good seal, without verifying the calibration of the resuscitation bag, and make a verbal note to document the intervention later. Option C. Delay bag mask ventilation to locate a specific brand of resuscitation bag mandated by a previous hospital policy that is no longer current, while continuing to monitor the neonate's vital signs. Option D. Administer bag mask ventilation using a mask that appears to fit adequately, but without confirming the calibration of the resuscitation bag, and rely on the attending physician to document the intervention. The correct answer is A. Immediately initiate bag mask ventilation using a properly sized mask and a calibrated resuscitation bag, ensuring adequate chest rise with each ventilation, and documenting the intervention and the neonate's response in the electronic health record. Explanation. This scenario is professionally challenging because it requires immediate, life-saving intervention for a neonate experiencing respiratory distress, while simultaneously adhering to strict protocols for equipment use and documentation. The nurse must balance the urgency of the situation with the need for accurate and compliant practice. The correct approach represents best professional practice because it aligns with the regulatory framework governing neonatal care, specifically the guidelines for the use of resuscitation equipment. This approach prioritizes patient safety through the use of validated equipment, proper technique, and meticulous documentation, all of which are mandated by regulatory bodies to ensure quality of care and accountability. Adherence to these standards minimizes the risk of iatrogenic harm and ensures that interventions are evidence-based and legally defensible. An incorrect approach, such as using a non-calibrated device or failing to document the intervention, represents a failure to comply with regulatory requirements. Using non-calibrated equipment can lead to inaccurate delivery of oxygen or pressure, potentially causing harm to the neonate. Failure to document the intervention is a breach of record-keeping standards, which are critical for continuity of care, legal protection, and quality improvement initiatives. Such failures can result in disciplinary action, legal liability, and compromised patient outcomes. Professional decision-making in such situations requires a systematic approach. First, assess the neonate's condition and identify the need for intervention. Second, select and prepare appropriate, calibrated equipment according to established protocols. Third, perform the intervention using correct technique. Fourth, continuously monitor the neonate's response. And fifth, accurately and promptly document all actions and observations. This process ensures that care is delivered safely, effectively, and in compliance with all relevant regulations and ethical principles.